Right here in Columbia, as the ACLU has filed suit against State Attorney General Alan Wilson, the State Department of Health and Human Services, and MUSC. The lawsuit stems from a bill restricting certain health care for transgender individuals. Our Chris English, he joins us in studio tonight with those details. Chris, what's going on here?
Well, Gerald, the lawsuit comes just 3 months after South Carolina Governor Henry McMaster signed into law House Bill 4624. That new law bans gender-affirming care for transgender youth, including puberty blockers and hormone therapies. The new law also bans state funding for transgender care for those over 18. Now, once the law goes into effect next year, it could have a serious impact on some of the lives of many patients.
But we have worked many years with therapists, with our child's doctor, and that will stop their treatment, which is unfair because we've already gotten so far into the treatment that if we stop now, that's a detransition, and that will be more harmful than it will ever do good.
Jessica Spearman lives in Anderson County with her 16-year-old transgender son. She says her son will lose access to puberty blockers and testosterone if the new legislation goes into effect as signed.
And that's where medical doctors come in. That's where mental health professionals come in. These are people that are experts in their field. And when we say do no harm, legislators who do not have the training are dictating what is happening with our children.
State Representative David Vaughan, a sponsor of the legislation, says those under 18 are not yet ready to make life-altering decisions.
If you allow a child to go through puberty, the statistics are overwhelming in the high 90s that they will not do transgender mutilation of their bodies. But in reverse, if you give them any type of cross-sex hormones before they go through puberty, it's the exact same percentage that they will continue and do transgender modification of their bodies.
Representative John McCravey III says the bill is about protecting children.
Well, the bill was called the Help Not Harm Bill. The main job of the bill is to protect minors from these harmful trans procedures that are well known to be harmful to children. And it also bans surgeries for minors that will permanently alter them. And so the theme going forward in the House of Representatives and the Senate from the leadership, from the Republican caucus, was protecting our children last year. And so it's always going to be a priority.
But Jace Woodam, executive director of the ACLU of South Carolina, says this legislation will affect more than just children.
This law has taken away health care for transgender adults who are public employees, who are patients at MUSC, or who are on Medicaid. So several of the plaintiffs in our lawsuits are adults who have lost care. Here's what this law says. Some people get to access health care services and some don't. Some parents get to make health care decisions for their kids and some don't. Some doctors get to follow the medical standard of care and some don't. Who gets to decide? Politicians.
The ACLU's lawsuit is active in the U.S. District Court but has not been assigned a court date yet. Now, this evening we reached out to several of the defendants in the case, including Attorney General Alan Wilson's office and MUSC, who both told us that they don't comment on pending litigation, with Wilson's office adding that they will, quote, vigorously defend the state's laws, unquote. Live in studio tonight, Chris English, News 19, WLTX.